Let's talk about fever. Fever is very common problem. And fever could be caused by more than 100 different type of diseases. And so just fever alone makes very difficult for doctors to diagnose what disease you have. So fever have to have other type of symptoms. Just fever alone and no other symptoms is a big problem, especially if it lasts more than a couple weeks. It's a big problem. I mean, you could have common cold, you could have just little fever, little body ache, and that's it. Yes, but it should go away. But if it doesn't go away for many weeks, then you need to go see a doctor and get proper treatment. If you have a fever, you have to think about what other symptoms do I have? Do I have a problem in the nose, throat, ear, head, neck? Then each area, as you could see, you'll have different diagnoses. Especially the most common ones, like upper respiratory infection. You'll have a throat pain or this area pain or problems, cough, sputum productions, things like that. Also, you have a problem with your lung. You'll have cough, maybe blood in the cough, frequent cough, chest pain, things like that. If you have a problem in your stomach area, abdomen area, then you have to think about hepatitis, pancreatitis, all these different type of problems in the belly. If you have a flank problem, you have to think about kidneys, spleen. So fever and flank problems, you have infection in your kidney, or pelvic area, you have to think about bladder problems, GYN problems. For male prostate problems or scrotum problems. So all these problems, you have to associate with fever and specific place. Then you could get diagnosis. The fever just by itself, like I said, is very difficult. So you always have to find secondary problem. Even not just the location, like diarrhea, like frequent urination. These things also associate with a fever. And also a pus anywhere, or cellulitis, or redness, swelling, pain anywhere. It's also associated sometimes with fever. So you need to tell these things to a doctor and get a proper diagnosis and treatment.